Governor Ron DeSantis says he will not declare a public health emergency for monkeypox in Florida. A few states and the White House went that route yesterday, though. As News4Jax reporter Aaron Farrar tells us, Florida has the third most cases in the country.
There are 577 reported cases of monkeypox right now in Florida. That's according to the CDC. Despite that, Governor Ron DeSantis says he is adamantly not going to declare a public health emergency for monkeypox in the state. The governor says states that have declared public health emergencies would abuse those powers. But so far, there's no evidence of that happening. He echoed some comments he's made in the past about the COVID-19 pandemic.
You see any of these politicians you see out there trying to scare you about this, do not listen to their nonsense. I am so sick. I am so sick of politicians, and we saw this with COVID, trying to sow fear into the population. We had people calling mothers worried about whether their kids could catch it at school. We are not doing fear. They're going to do facts, and we are not going to go out and try to rile people up and try to act like people can't live their lives as they've been normally doing.
Agriculture Commissioner Nikki Fried, who hopes to run against DeSantis for governor, wrote a letter to DeSantis asking him to declare a public health emergency to get more resources to treat those affected. A part of that letter reads, quote, Floridians need to know key facts such as when should they get tested, at what point they are contagious, and how long they need to quarantine if infected. But unfortunately, there appears to be a severe public knowledge gap when it comes to monkeypox. Charlie Crist, who is also running for the Democratic nomination, released this statement, quote, Governor DeSantis should not dismiss the risks of monkeypox to Floridians, and to do so while making an AIDS comparison is repulsive, revealing, and factually wrong, end quote. According to the CDC, monkeypox can be contracted through face-to-face interaction or by touching a contaminated surface. Many cases are related to men having sex with men when a sexual partner within 14 days received a diagnosis of monkeypox or is at risk if there were several sexual partners in a 2-week span in an area with known monkeypox cases. It is important to note it is possible for anyone to be infected with monkeypox, and that can happen through touching contaminated surfaces. However, researchers say that is rare because of the fact that it takes longer periods of interaction or a bigger buildup of monkeypox in one particular space in order for that to happen. Reporting, I'm Aaron Farrar, Channel 4, the local station.